two ways here. First, we're going to go through the paperwork. So we're going to follow the New Mexico EMS medication administration. We're going to go step by step through that, and then Brandon has offered to offer his arm first, and we'll kind of do a demo.
Before we pass out.
And then you guys get the opportunity to work on each other afterwards. Everybody gets to do it. So. All right. So if we kind of look at this step by step. Now, remember, I know we got some new guys here, but the old guys, when we did epi, it was built for fireman hands, right? I mean, just grab it and slam it in. That didn't matter if it was jeans, leather, it was going to go in. So it's fine. Now we're dealing with a very fine needle, and we're dealing with a tiny little bottle. So it's going to take a little bit of finesse on our part to make sure that we're not bobbling things around while we're doing this. But so if we take the first step, take verbalized body substance isolation precautions. What is that? Right, everybody got their hands up. So that's basically, when we go through this process, the very first thing we're going to do, we're going to glove up. What else do you wear? Okay. Secondly, if the patient is conscious and able to talk, find out their allergies. If they're obviously going through anaphylaxis shock, then we know what's going on, and we're checking their breathing. If it's not doing well, then we can then proceed. Okay, second is the check medication. So you guys have the vial out there, but you're going to check medication, you're going to check name, you're going to check expiration date, you can check for concentration and clarity. Second, after that, we're doing a little bit different out of order to keep things kind of on track. We don't want to necessarily draw up a dose and then sit the needle down and then have to go and then get the prep site ready. So we're going to prep up the person first, okay? So the way we're going to prep up a person, so because this is going IM and this needle is an insulin needle, are we going to be able to shoot this through clothing? No. So we need to expose a person. Generally, we're going to shoot for the deltoid part of the arm. I've injected it 4 times today, that's why it's so big. So, technically the deltoid muscle, if you would have a diagram, would come down in a triangular motion like that. Okay? So, generally the way that we've in training been told to find the best injection site into that deltoid muscle is do the 3-finger right on top of the shoulder. So if you put 3 fingers there, right below that is going to be pretty much the center point of the deltoid muscle, okay? And so look for some kind of mark there that you can pinpoint, and that's going to be your spot. From there, you're going to get the alcohol swab. You're going to clean that area in a bigger area than just the shot area. So, you know, a good circumference. After you've done that, with the epi, you'll pop the cap. Today we're going to be doing sodium chloride, but with the epi, you'll pop the cap. If you want to, you can alcohol swab that as well. And as we take one of these off, we practiced with the first group today. One of the things, again, your adrenaline's going to be flowing. Your guys aren't going to be used to this. It's going to be one of the first times that you're doing this. So a lot of times people are a little hesitant how they pull it, and when they pull it, they tend to kind of jerk themselves back. And we had 1 or 2, just last one, that kind of pulled back. So just in one kind of clean motion, just pull off, and you've got your needle exposed. From there, I'm not going to go through the whole thing on this part, but we're going to go. And because this is a negative pressure in here, you've got to pull back to the dose that you want, okay? So 15 for peds, 30 for an adult. So as we do that, we'll then insert that in. As we insert it in, then we'll just blow the air in and then draw back. okay? As we drop back, we look for any air bubbles, but if you've got it tilted back from the get-go and you've got it balanced pretty well, you're going to get there's going to be enough in that bottle that you won't have any problems to get the syringe filled to where you need it, okay? From there, what type of shot is this? So pretend this is uncapped still, but what type of shot are we giving?
IM.
Okay. IM, so again 90 degrees. So we're looking at that spot that we've cleaned. So now one of the things about this needle is that it's not a full like 1-inch needle, and sometimes this white mechanism can slide up on you a little bit, so just make sure that it's down as far as it can be. And some of this will be on visual inspection of the patient. So if it's a skinny patient, then you can just basically grab there and go straight in at 90 degrees and inject. If it's a larger patient or an obese patient, sometimes you actually have to spread that skin out a bit, okay? Because otherwise we're not going to get that medication in IM. It's going to stay more in the fat tissue. So as you spread out and you inject, one of the other things we want to do is keep that syringe needle in for about 5 seconds, because sometimes if you inject and then pull out quickly, especially if it's a larger person, you'll start to see some leakage coming out. So just like we did with the EpiPen we counted to 10. This you'll count 3 to 5 seconds. Go ahead and remove. Then we're going to cap immediately and then put into the sharps container that's floating out there, and we'll be good to go. Band-aid up, and so if we want, we can do a demonstration.
Yeah,
Do that.
sounds good. Where's the black med box?
Do you have any questions?
Did you guys get to see it? Okay.
Yeah.
So I'm just going by this protocol.
Yeah.
This thing you talked about aspiration of blood and then the push rate.
Yeah.
This is a good question.
So while I was kind of going through that, I skipped one section on there. It talks about aspiration for blood. I went through the CDC and a few other sites. This has been a question that's been going on for probably about 5 or 6 years. Do you draw back to see if you're in a blood vessel or not? In our case, in most cases, they say it's not necessary anymore. In fact, the deltoid muscle is a muscle that rarely you would hit a big blood vessel, and if you did with epinephrine, it's okay, because I mean we need it to get flowing into the blood as quickly as possible.
We're not checking in with the patient.
So we're not going to aspirate, okay? Generally, it's people are kind of fumbling around trying to pull out and see if it is, and then you got to take it back out, put it back in if you are, and so there's just too many things that make that problematic. So we're not going to aspirate. Administration rate, one of the other things there is just a slow, steady administration. Some people, again, because adrenaline's flowing, is you're just going to crank that through. You can do that. It just creates just a little bit more of an uncomfortable sensation for the patient. One of the other things, again, because of the length of the needle, you can push that hub, though, all the way up to the skin. You can push and even kind of have a little bit of an indentation there. That's not going to be a problem. So don't be afraid to, when you're inserting that needle in, to go ahead and just push it straight in. Okay? After that, then it's just verbal documentation of everything that you've done.
And something that I was telling the class earlier is something that kind of helps me, because this thing's kind of small, and is I kind of hang on to it pretty well, and then I use my other hand to kind of use this hand and just kind of lock my hands together a little bit. So when I push it in, the needle is small and it will kind of move and bend and do things. So I put my hands together, right? So I'm going to inject, let's say 0.3 into there, right? You got to let the vial breathe. So then I hold it, push it in, and then I can hang on to it, right? You can either hang on to it with your pinky, whatever you want to. Push it in, and then you can draw back. And if you go past 0.3, it's okay. There's 1 milligram per milliliter, and it's a single milliliter. So how many doses of medication do we have, adult doses, do we have in this little guy? 3. There's a bunch. 3 and some change. So if you have some air in there, then you're okay to get the air out, right? And if you spill a little bit, that's okay. Just keep it out of your eyeballs, right? I do the same thing when I'm giving a shot, is I'll rest my palm on the patient's arm. Have them relax their arm just like they are, and I'll rest my palm there, and then you can flatten it or pinch it, whatever you need to do depending on the patient. Rest your palm, and then just put it in. Go straight to the hub is fine, unless it's a super skinny patient, but typically if you're pinching it, you're still going to be okay. This keeps you from sewing. We don't want to sew on the patients. And I've seen it, and it's bad news. They go to give a shot, and they're like, yeah, D. Let's avoid that. Single shot, give it, wait a couple seconds, bring it out, drop it in the sharps. Cool?
So things are going to happen. You know, I've been doing immunizations for 4 or 5 years. Needle, just you're getting ready to draw up, or I'm getting ready to go administer it, and something happens and you just fumble and the needle hits the ground. So you've got enough dose in there. You've got an extra needle that you can just go ahead and restart over. I mean, worst thing you can do is try to pick up a needle off the ground and then go ahead and try to inject somebody with it. So just make sure.
It's bad. Bad news. So everything you guys need will be in the front part of this deal. So you just bring everything out. You can set the sharps up just like this, and then everything you need. There'll be 2 syringes in there, at least 4 alcohol wipes, and then a couple of Band-Aids. Cool?
All right, you want to do one?
Sure. And then this is a multi-use vial. We're doing it for training. So when the cap on this, we'll set it on there to get used to popping the cap. But since we're using this over and over, we're going to clean the top just like when you went through EMT school. We're going to clean the top every single time. When you do it on this, for an actual patient, you don't necessarily have to, because it'll be clean and be sealed and good to go. But if you do, it's not going to hurt anything. So it's not a bad habit to get into if you choose to do so.
What's I guess I'll ask you. It's just a protocol after you say administer a dose. So we're going to put a new vial in there? Or
Yep. It's going to be same as Albuterol, same as Narcan, all that stuff. You'll keep the old one, bring it back, and get a hold of your battalion and have him bring you a new one out, and you'll swap. This one will go in the cabinet as used medication, and then you'll have a brand new one. You'll have syringes at the station, everything at the station. Just like we do Band-Aids or alcohol swabs or whatever.
We decided there would just be too many logistics in trying to keep an old, well, once it's already been punctured, 2, you know, if you're the one that gets the very last dose and you're having a hard time getting it out of the vial. So for the cost of this, it's all right. We're just going to get the 1 dose and maybe have the 2nd dose if you need it while you're there on site.
1 vial per patient. You can give it to them twice if you need to, but that vial then goes away. You get a new one. Cool?
Okay.
All right.
So safety protocol, looking for the site. Gonna shoot for right there. On the camera. Pop that off. One fluid motion. Draw back. Draw up. Locate our site. Gout. Cap.
Get that armhole's full of it.
Band-Aid. And then do all of our visual documentation we need to do. Any questions?
Yeah? Cool.
Come on in.